Each time now is 8 minutes to 8.
Yet again in March, the government set out its official advice on healthy eating. Cut down on full-fat food and base your meals around starchy foods such as pasta, potatoes or rice. But the National Obesity Forum and the Public Health Collaboration say that is wrong. And in the words of the heart doctor, Dr. Aseem Malhotra, it is perhaps the biggest mistake in modern medical history because it is resulting in devastating consequences for public health, namely obesity and type 2 diabetes, where we're joined by Dr. Malhotra in Westminster and from Shrewsbury by someone who advises the government on obesity, Professor Susan Jebb, Professor of Diet and Population Health at Oxford University. Good morning to you both.
Good morning.
Good morning.
Dr. Malhotra, what is wrong with the official advice?
Well, I think let's just look at the root cause of this. So we've got this message that has demonized fats, in which has dominated dietary advice since change in advice in 1983 in the UK and previous to that in America, 1977. And what's happened is, and this was based upon flawed science we know now, it's resulted in people, choosing or eating more refined carbohydrates and sugar in particular. And we look at the totality of the evidence. The problem is it drives people away from eating whole, nutritious foods, which include, oily fish, olive oil, nuts, and eggs, for example. So, people are choosing these low-fat options, and there's a huge industry that has developed, whether it's marketing of drugs to low cholesterol, but specifically low-fat foods that are loaded with sugar, processed foods. And the consequences have been quite devastating, in particular for people who are at risk or who have type 2 diabetes. This is a condition, until many years ago, was actually referred to a condition of carbohydrate intolerance. And what we mentioned in our report is the fact that there is a GP up north called David Unwin, who's won an NHS Innovation Award, who has gone against conventional advice, which we believe is actually driving the problem, and for his patients who have type 2 diabetes, at risk of type 2 diabetes. And what's extraordinary is, and he's advised them to reduce the refined carbs and sugar and just eat until you're full, which is basically, I follow my own advice, I do the same thing. What's extraordinary is he's managed to reverse type 2 diabetes in many of his patients and actually reduce the need for medication. So, this advice, unfortunately, with the best intentions, has actually, in our view, caused harm.
Professor Susan Jebb, best of intentions, but the problem with advising people to eat low-fat things is that they're loaded with sugars.
I think most people now recognise that obesity has increased because food is widely available, it's relatively cheap, it's in large portions. Quite simply, we are eating too much. It's inconceivable that the advice that Aseem is offering, that you should eat as much unrefined carb as you want and as much saturated fat as you wish, will help people to lose weight. It's also a bit strange for him to talk about the totality of the evidence. One of the things which is making so many scientists so very cross this morning about this report is it cherry picks the odd study here and there which supports this view. The overwhelming evidence taken from good, high-quality, systematic reviews which put all the evidence together, I'm afraid, does not in any way support the assertion that you should be eating more saturated fat.
Dr. Aseem Malhotra, you're cherry-picking evidence.
I think that's complete and total nonsense.
Aseem, there are only 5 references in your list of over 40, which is systematic reviews. And systematic reviews are the accepted way of gathering the evidence.
Okay, let Dr. Malhotra come back on that. You have not shown your references. What you're claiming is unsupported.
That's absolutely incorrect. That is a complete untruth. If you look at the report, it uses actually the most recent high-quality evidence. Even Cambridge Medical Research Council did a very large study looking at this, published in the Annals of Internal Medicine 2014, looking at over 600,000 people, and looked at saturated fat specifically for heart disease. But can I just make one point here to Professor Jebb? We're not saying you can consume as much saturated fat as you like. We're saying the demonization, no, we're saying saturated fat does not cause heart disease. And if you follow a dietary pattern, and that's very clear, and we've got multiple randomized controlled trials to support this, compared to the low-fat message, it's better for weight loss. And in fact, the other thing I must mention, and I think this is important, very quickly, I have a lot of respect for Professor Jebb, but I also think that there is a problem of commercial influence biasing views of academics, and she has, taken funding from Weight Watchers, Coca-Cola, and I think all of these things has biased her view.
My research has, one study was funded by Coca-Cola. We showed the product didn't work. We've been there before, Aseem. Your report says that people can our recommendations for weight loss include ad libitum, that's freely, low refined carbohydrate and high fat diet as an acceptable, effective and safe weight loss.
Very briefly, people listening to this will be thinking, what do I do? We do have a problem with the advice in that it doesn't seem to be having an effect on what is actually happening to the nation. We are all getting fatter and type 2 diabetes is going up.
The problem is people are not meeting the recommendations. Only about 5% of people meet the dietary recommendations, and there's very good evidence that those who do have a lower body weight and better health outcomes. We need to support people to make important changes in their diet. That does include cutting down on sugar, but it also includes cutting down on saturated fat. People need real help, and this kind of confusion doesn't make it easier for people.
Professor Susan Jebb and Dr. Aseem Malhotra, thank you both.
Time for the weather forecast. Here's Joe Wynn.